Good evening, and welcome to Talk of the Bay, KSQD's evening talk show every weekday from 5 till 6 o'clock. I'm your Thursday host, Rachel Ann Goodman, and it's my great pleasure to be here behind the microphone here at Community Radio K-SWID. Tonight we have two different topics, as we often do. The first one is addiction. It rears its ugly head even bigger around the holidays. We'll talk about how you can support people who are going through recovery and how you yourself might seek help if you are struggling with addiction. We'll also talk about some new programs available for people seeking recovery themselves. We'll talk to the leaders of Janus, a local addiction recovery program that's been in business a long time here in Santa Cruz. And then in the second half of the program, we'll talk to organizers of Santa Cruz Gives, a local fundraising organization that directs donations to local nonprofits. Nonprofits are the backbone of our community, and we salute you and them. We'd like to thank a couple of folks who gave during Santa Cruz Gives so far: Scott Harriman and Jeff Schwab, Troy Challenger, Amy Mills-Naim and Baruch Ben-Naim, and Patricia Holt, among many who have heeded the call to support K-SWID. I'm here right now with the two leaders who are really keeping Janus alive. Janus is the addiction recovery program we're going to be talking about. I'm here with Edison Jensen and Amber Williams. Edison is the chair of the board of this nonprofit, and Amber Williams is their CEO and has been for 30 years. Edison has been a leader of nonprofits from Salud para la Gente all the way through to being here at Janus and many other stops in between. He is also practicing in the legal profession. He's got a number of hats. Welcome to the both of you. Thank you for being here.
Thank you, Rachel. It's a privilege to be here.
Thank you, Rachel, for having us.
We were reminiscing about the old KUSP and how we were next door neighbors for a while down at 7th Avenue. And you've grown since then. And I want to talk about where this organization is after so many years of being in business. I am not someone super informed about the way people recover from addiction. All I know is that these programs can really help people, and when nothing else has. So maybe we should start by, what is Janus, Amber, and what does it do for people?
Janus is a local nonprofit that has been in business for the past 48 years. You're right. We used to be share a building together with KUSP. And we are a local nonprofit that provides substance use disorder services in our community in a varying range of ways. We have a continuum of care: residential, withdrawal management, perinatal residential services, outpatient, medication-assisted treatment. So really just being a bridge or a gateway to those that need help and are reaching and asking for help.
And when you said perinatal, can you define what that means?
Perinatal is everything around the belly, so a mother that is pregnant or postpartum with a baby up to a year. Although we serve women with children all the way through their life, but we have the ability to have children in care with their mothers in the belly, pregnant, as well as up to the age of 6 in our facilities.
And I want to talk a little bit more about how you do that, given, there's a really delicate human being in there that also is getting maybe some of the treatment. But tell me, we had the impetus for you to come here is a new center in Watsonville. So can you talk about that briefly?
Yeah, we have an aging Victorian downtown Santa Cruz. It's beautiful, but it's aging and it's challenging to treat women with children or pregnant mothers in care. That's a 10-bed facility now. And we were selected by the Department of Healthcare Services and awarded about $5.8 million to purchase and build from the ground up a 25-bed state-of-the-art medical facility to support women and children. And we'll expand the age of the children coming into care up to the age of 12. So we'll be able to help a lot more youth in our community that are suffering, as well as reach those members in our community in the South County region.
Right.
Yeah, and I think it's really important to note that oftentimes in the delivery of healthcare services in the county, Watsonville is oftentimes ignored. So our board made a concerted effort to shift services to the most needy in the South County because we have a large farm worker population, that needs access to these services because they put the food on our tables and oftentimes are ignored. So we're really delighted to move into South County. It's going to make a huge difference in the lives of those that are affected by substance use disorder. So we're really pleased.
So how does the funding happen? Do you get assistance from federal, state, local, or out of pocket? How does your funding structure work?
Yeah, that's a really good question. Our funding really is passed through government, and I'll have our CEO explain that a little more. But one of the things that happens is you've got to have a really good relationship with the county. They're your partners because it's really their jurisdiction and their public health issue to address, but they can't do it alone. And it's not enough to sit on the couch and shake your fist at the TV and say, government's got to do the job for us. Those days are over. Nonprofits who have the expertise and the ability to deliver these services have to partner with government, not see them as enemies. And we've developed a really good working relationship with the county that has allowed us to get the contracted rates that help us serve the community. We didn't always have this good relationship with the county. But when I came on board, I made that a priority, and Amber's really carried through that in developing the relationship. So now we have the confidence of the county, and we've also get state funding. Amber, where else do we get our funding?
Well, we have, I like to say, probably 52 funding streams that come through Janus, and that could be self-pay. Someone walks in and wants to pay to come into detox or withdrawal management. It could be private insurance. We're contracted with most commercial payers, Anthem, Aetna, any commercial payers. We have a contract with to provide care. We also have state funding, Medicaid, Medi-Cal dollars, and a lot of grants through the federal government and Substance Abuse and Mental Health Administration in Washington, D.C. So and a lot of grants that support the work we get to do. So it's very diversified, but mainly supported by governmental dollars.
And in this industry, is it heavily regulated, or would you say there's a licensing process that means only certain people with the expertise get to do this work? Because I've heard of some mixed reviews of some organizations that kind of take advantage of people's desperation and take their money but don't actually produce recovery, and that's a really kind of a problem I've heard.
Yeah, that's a really great question. That used to happen in the past, perhaps even in this county, but we've gone to a medical model now, evidence-based, so it is highly regulated, and we are CARF accredited. And maybe, Amber, you can talk some about the regulations, because we do have regulators that we have to answer to.
Yeah, we are very hyper-regulated. We're in an up-regulation as a result of exactly what you said. Treatment facilities taking advantage of individuals needing help and then not delivering the care. We saw that with Medicaid dollars in Southern California, most notably and most recently. We are constantly in audit mode all the time, audit ready for someone to come in. You know, it's really hard to obtain licensure to deliver and give these services because they're so high risk, and the patients are at such high risk. For instance, Janus is the only withdrawal management program in Santa Cruz County. We're the only Peri-Natal services program within a 100-mile radius. So we're the only narcotic treatment program in North and South County in probably an 80-mile radius. So we deliver a lot of services that are very hyper-regulated and hard to obtain licensure to deliver, and hard to deliver services.
Tell me about a success story, because I'm sure you've also seen some that weren't. People just couldn't stay with the program and burned out of it, or just left because the draw was too strong for their addiction. But you've also probably had some really amazing, wonderful moments where the person looked like they were going down, and then somehow you saved their lives. So tell us about those. Those must be the good moments.
Yeah, and you know, it's interesting that you say that, because now we're in the holiday season, right? And everyone knows of someone who suffers from the effects of alcoholism or substance abuse, and it tends to increase during the holidays. A lot of anxiety, and so we're in a position here where we we're in the business of salvation. Earlier you said, oh, you've been in the business a long time. Well, the reason we're in business is because this is a never-ending process. There is no cure for addiction. What we try to do is treat people in such a way through medical services so that they can maintain a lifestyle, so that they're not out on the streets. All you got to do is look anywhere, and you'll see those individuals who are out on the streets that can't get the services that we provide. And the success rates are hard because addiction is hard to overcome, and you need support. But Amber's the one on the front lines that sees these success stories, that sees the struggle. So tell us what you've seen, Amber, because it's pretty stark sometimes.
It was a pretty profound moment about a few months ago in the summertime at Janus, Maine, on 7th Avenue, right by the beach, Twin Lakes. Everyone's got their beach bags headed down to the water. And it's about 6:30 in the morning. I hadn't got to the office yet. We have facilities that's around the building and staff that work in a 24/7 residential care setting. And a staff member walked around the facility and saw a gentleman slouched over and put his hand on his shoulder. Joe, I'm using that as, as just a name. Joe, wake up. And he didn't. And so we have all of our staff carry Narcan on them. That's the overdose prevention drug. And we administered 2 doses of Narcan. And then that was our staff person that was doing rounds and walking around the facilities. And we administered 2. The staff member called for support from other staff that was around. They came. We administered another 2 things of Narcan and brought this young man back. 911 comes, ambulance comes, and takes him over to Dominican Hospital, of which Edison Jensen has been on the Dignity Board, was previously on the Dignity Board for 13 years, and some of that term served as the chairperson of Dignity. But this gentleman went to Dominican, was served. We said, we'll bring him back. We want him back. He needs us desperately. He's literally almost died on the side of our building waiting for care. And he came back to care, and his mom walks up, and it's somebody I know that works in the field. We had no idea. And come to find out, we brought him into service right away, and we're able to give him medication-assisted treatment to subside the withdrawal symptoms, and found out it was his birthday. We saved a life on someone's birthday. It doesn't get more real than that. It's happening on a daily basis. The numbers are skyrocketing.
Is it mostly fentanyl? I was going to ask.
Yeah, and now everything's laced with fentanyl, so it's hard to decipher between, is it methamphetamine, fentanyl, opiates, heroin. It's all getting categorized as fentanyl because everything's being laced with fentanyl because it's an easy, cheap way to manufacture over the border. It's coming from Mexico through China. So, it's real, and it's happening as people are waiting for care in our community.
I've heard a lot about, efforts to try to get Narcan in everybody's hands, including, teenagers going out to parties, just so it's in everybody's hands so they can do what you all did, which is save a life instantly right then and there. So
yeah, absolutely. I've got a 19-year-old daughter, and I've always encouraged her, take the Narcan with you. Someone may need it, and you can save someone's life instantly. And quite frankly, it should be readily available over the counter. And, you should really just give it out free. It shouldn't cost anything to save a life because, quite frankly, if you have to take them to the hospital, the emergency room, the cost to society is exponential compared to, a dose of Narcan. Because I'm holding a pencil in my hand right now, and 2 milligrams of fentanyl fit on the tip of a pencil, and that is enough to kill you.
Wow.
And so no one knows that, and you can't grab drugs and just use them and not expect to have bad outcomes. So, it's a new world today. Taking a look at if we go to the statistics here in the county, when it comes to acute-related drug deaths relating to fentanyl, last year we had 65 fentanyl-related deaths. As of June of this year, we're at 53. So we're slated to double. And nationally, we've reached over 100,000 fentanyl deaths. And the leading cause of deaths for people 18 to 45 is fentanyl now.
Wow. And then a toddler recently died in the Bay Area. Yeah, you think it's happening some other place when you read books like, Demon Copperhead by Barbara Kingsolver, which was about drug abuse and, recovery. And it was in eastern Kentucky, so it felt like, well, it's happening in rural areas. It's not, right? It's happening everywhere.
Yeah, and you raise a really good point. People want to say, well, it's not happening to us. It's not happening to me. It's the people you see on the streets. That's who it's happening to. But that's not the case.
Could be any of your kids who happened to smoke a joint at a party that was laced with fentanyl, right?
Exactly.
Only 2 milligrams. That's terrifying. And how do you can't, there's no test. It's not like a roofie. There's a dipstick you can put in your drink and it'll say if it's been drugged. There
actually is fentanyl test strips that you can get through the county health office on Emmeline campus. You can come to Janus. We'll give you some test strips. But there are fentanyl test strips that we try to hand out as much as possible, especially in the youth population, because you can test your drugs before you use them to know if there's fentanyl that exists in them.
And if someone happens to find it, is there a way they can report? It's hard to report your dealer, right? Because you don't necessarily know where they got it, but it might be good if it could track down immediately to the source, because if it's one person spreading it all over, if you found that one person, you could save a lot of lives.
Well, and I think it's, when I was a child and going out and going to parties and stuff, we didn't have the risk of dying when you would take something. It's very different today for our youth. And so being able to normalize for parents that are out there, normalize and having the conversation, opening the conversation with them. Hey, how is it going? When you went to that party, were there things there that you were worried about? Have you heard about this thing called fentanyl? Do you know what Narcan is? You can come to Janus as a distributor, a Narcan distribution for the state. You can come to Janus on 7th Avenue, 207th Avenue. We'll give you Narcan for free. We'll train you how to use it. We'll train your children how to use it. So it's really about opening the conversation with your kids.
What's the most common story you have when people come in your doors? Is it usually drug addiction or alcoholism that takes the precedent over the other?
Well, it used to be, in order to get compensated for care, you'd have to go through 2 doors. There was the mental health door and there was the drug addiction door. And they would say, we can't treat them both. But the problem with that is there's a comorbidity of people who have substance use. There's a mental health element. I think it's like 80% or more of all our patients have that comorbidity of mental health. So we got to treat them both. So go ahead and answer the other part of that question when she was talking about
which do you see more of, alcohol or drug addiction when you have people counting?
It's probably about a 60 to 70% on opiate. I mean, now there's so much mixing of multiple substances happening that it's hard to pinpoint, primary, secondary, tertiary diagnoses or substances that folks are using. Alcohol use disorder is very prevalent in ages. We see it more in ages anywhere from 40 to 65 that are seeking care, as opposed to maybe opiates, fentanyl, methamphetamine in the population of 18 to 45, 50. So it just depends. But probably around a 70% opiate, methamphetamine, fentanyl, and 30% alcohol use disorder.
That's Amber Williams of Janus. She's the CEO. I'm speaking with her and Edison Jensen here from Janus, a addiction recovery program. As far as training and what Edison said about, the comorbidity, basically that it's hard to separate the addiction from mental illness. How do people train to be doctors in this field? Because they're so different. I mean, we have everything so siloed in our medical system, even the way doctors are trained, like the psychiatrist for your brain and addiction specialist for your drug abuse. How do you mesh those together? What kind of people can you attract that know how to do this work?
Yeah, that's a really good question. When I was chair of Dominican Hospital, we didn't really have what we call board certified physicians in addiction specialties, right? They would they would present at the emergency room and they would be released. And it's just a vicious cycle of uncompensated care. And one of the things that we talked about is we need to partner with the Dominican Hospital to take those patients away. They're more appropriately to be served in Janus and outpatient, but we're lucky to have Dr. Washington. Why don't you tell him about him, because he's really good at what he does, and we're very lucky to have him and specialists below. Maybe you can tell us about the...
Yeah, we have a
as well.
great Dr. Bill Morris, too, as well, who's been a medical director at Janus for probably 20 years, is also still our medical director for the clinics, but our chief medical officer, Dr. Jason Washi, who's board certified in addiction medicine. And there's very few board certified doctors in Santa Cruz County in addiction medicine. So we're always trying to recruit and retain and provide and board certified in our specialty. But Jason's also the chief medical officer for the medication assisted treatment programs for the California Department of Corrections, where they're seeing an increase fentanyl poisoning in the prisons and the prison system. So he has helped spearhead and implement and bring that program, stand that program up in the prisons. So he's pretty influential when it comes to the work that Janus does and reciprocating that into the prison system as well. So, you know, we also have psych NPs, nurse practitioners, and working at Janus, we pay for those individuals to go become board certified in addiction medicine. We value that enough, moving from a social model to a medical model, to train the medical staff appropriately. We also are partnering with Dominican to do a rotation for the med school students. So that's another way that instead of just going into family practice, they'll come to Janus and do a rotation at Janus to learn addiction medicine. Previously, the emphasis in med school was only an 8-hour class to learn about addictions out of 12 years of education. So we're making inroads to help train our medical professionals.
Yeah, it sounds like good progress is being made.
Yeah, I think it's really important for the community to understand that this organization is bringing those resources to serve this population. They probably don't know that exists if it wasn't for community radio and K-Squid. So we're very happy to have to be here to share that with the community. So we are going to continue to do that. And, you know, part of what we also do is you know, you can't expect people to just come to you. Sometimes you have to meet people where they are. And we're starting the Sobriety Center now. It's a whole new ball game that almost reaches out on a, you know, it's kind of like street medicine, but not. The population that's going to be served by the Sobriety Centers is the 647S, the drunks and publics, and the DUIs.
The people who would normally end up in the jail in a drunk tank for overnight and gets released the next day, right?
Yeah, so what we've decided to do is partner with law enforcement, all the jurisdictions, and the county, because if a Watsonville Police Department or Capitola PD or CHP arrests someone on a DUI, they got to book them into the county jail, and that's a minimum of 2 hours. So they're taking their officers off the street, spending 2 hours booking them. If they're combative, it's going to be more than 2 hours. At the Sobriety Center, we process them in 7 minutes. That means these officers are back on the streets taking care of violent crime, rather than using the jails to house people that are suffering from a disease with its own diagnostic code, because it is a disease. What else can you say about that?
Can you give someone something who's super drunk and acting out, something to quickly bring them down so they're not dangerous to themselves or others?
I think we can do biopsychosocial interventions, evidence-based interventions in real time in the Sobering Center. It's a 23-hour, 59-minute facility. We will do door-to-door transitions to our withdrawal management program, residential treatment center. We're going to hang an open sign for people that want to walk in and get care and engage them.
And when is that opening? Sorry to interrupt.
Oh, that's in early January. We'll be in our partnership with the Sheriff's Office. And what's great now is we're in partnership with the Alliance, which is the managed care plan in Santa Cruz County that is also invested in us delivering really good care to these individuals that need us and really linking them door to door to the services that they need.
And they're not worried about getting a ticket right at that point. They're not just racking up legal fees. Or
no, they're not. We've made an agreement with the Sheriff's Office that they're really just detained and then they come to us and get care. And instead of this approach of like, oh, they've had all these drunken publics, we're going to put them in county jail. They've had all these drunken publics. They need a higher level of intervention from a clinician that knows what they're doing because it's a disease. So it's really shifting the mindset from that moral failing to disease model. of care.
And I know we won't have time to address this, but maybe at another visit you would be interested in weighing in. I know there's a lot of controversy around trying to reduce harm by giving out needles and things like that. And that population is probably a street intervention kind of thing that's going on, trying to keep people from getting diseases and so forth from their addiction. I don't know if that's something you also handle in-house yourselves, trying to make sure people are using, if they're going to do it at all, not kill themselves doing it.
Well, this is a very important issue because the people that will present at the Sobriety Center are people that are unhoused with addiction problems. And a lot of times they have injection wound sites that are infected, and they wait till the very last minute. They present at the emergency room, and then it's a huge issue. We want to address it on the streets where we meet them to reduce that, because it's a public health hazard. Because one of the things we are seeing is an increase in syphilis and other communicable diseases that are absolutely preventable because they're sharing needles.
Mm-hmm.
And so I understand that there's some resistance from some community members, but you have to balance that with the public health risk that is only increasing. So,
and Europe is pretty far ahead of us on this, I understand.
Yes.
They've really kind of set the model. We only have a minute or so. Any final thoughts or directing people to your website or anything that you'd like to do?
Yeah, let me make a final thought. We have been designated a center of excellence now because of our CEO, Amber Williams, and she's going to go throughout the state to replicate the model that we have. That's how high we're held in high regard by the state. So the community gets the benefit of that. Do you want to have the last word?
Thank you, Edison. Just if, during the holidays, if you feel alone or you know someone that feels alone or they're having difficulties or challenges, just pick up the phone, call us. We're here. We'll walk you through it. It may not be detox, withdrawal management. It may just need you may just need a warm conversation, someone to talk to walk you through and guide you to the next step. You can reach us at 831-462-1060. And our website is Janus, JANUSSC for SantaCruz.org. Thank you, Rachel, so much for having us today. We really, really value being able to speak to the community.
Anytime. Let's have you back soon.
Thank you very much.
Thank you.
Thanks for being here. That was Edison Jensen and Amber Williams of Janus talking about their programs. Coming up in just a few minutes, we'll be talking with Santa Cruz Gives people who are in charge of fundraising for all these wonderful nonprofits in our community. Stay tuned. We'll be right back after this short message.